cardiovascular disease, endocrinology, diabetes and metabolism, gastroenterology, including hepatology, hematology, infectious disease, nephrology, oncology, pulmonary disease, rheumatology, allergy and immunology, adolescent medicine, critical care medicine, hospice and palliative medicine, neurocritical care, sleep medicine, and sports medicine. These are our specialties. One of the reasons I picked internal medicine is because I couldn't let go of most things medicine. To me, a doctor could handle anything at any time, any place, and anywhere. Internal medicine serves as the foundational training that opens doors to various subspecialties, providing a comprehensive understanding of the human body. Internal medicine physicians take a 360-degree approach to patient care because they're able to see the big picture and how everything in the body is interconnected. They serve as the first line of defense in diagnosing and managing a wide range of medical conditions, and they're specially trained to treat patients comprehensively. Eventually, I selected two subspecialties to focus on: critical care and pulmonology. Internal medicine physicians and subspecialists manage and work to prevent chronic diseases, such as cardiovascular disease, which is the study of heart diseases, and disease management often includes working with many subspecialties within its own field and creates diversity throughout your work week. You may need to perform an electrophysiology study on the heart to find where an abnormal rhythm originates, or you may need to open a coronary artery to save the life of someone who is having a heart attack. We all know diabetes leads to high blood sugar levels, but the consistently high blood sugar levels can increase a patient's mortality over time. We need an endocrinologist to not only manage blood glucose levels with all sorts of therapy, but also diagnose potentially life-threatening disease like hypothyroidism or adrenal insufficiency. In the intensive care unit, I've encountered significant hemorrhage from the GI tract. I can give the blood back and can stabilize the patient, but the gastroenterologist can be responsible to stop the bleeding, especially if it's esophageal varices or a bleeding peptic ulcer. The hepatologists are going to help us manage the liver disease. If you're in love with the immune system more than I am, you might build from your internal medicine foundation to explore allergy immunology or rheumatology to understand how cells speak to one another and possibly overreact to molecules in the air causing asthma or to your own body causing rheumatoid arthritis. Sometimes cells within the bloodstream can grow a little too much, too quickly, and we need a hematologist to identify what kind of blood cell it is. They're going to look at a peripheral smear to inform us which blood cell is bad and how to treat it. If they need more information, they may do a bone marrow biopsy to check out the home of the white and red blood cells to see who is behaving poorly. If we see extra tissue in a certain organ, our interventional pulmonologist or gastroenterologist may need to sample a piece of tissue to allow the oncologist to look under their microscope to identify a cancer. They may look at receptors on the cell to prescribe precise therapy to rid the body of the malignant cells. The kidneys are sensitive organs and need to be looked after by nephrologists under distress caused by dehydration, autoimmune disease, or urological blockages. We all know organisms activate the inflammatory response leading to septic shock. Critical care specialists such as myself and infectious disease doctors work together to identify the organism, and the ID docs are going to narrow down the antibiotics or antimicrobial to assure the patient continues to improve. At times, life has run its course, which happens naturally, and we have to ensure both the patient and the family is comfortable throughout the dying process. Hospice and palliative medicine are essential in this process to make certain dying is comfortable for the patient and the family. This is not an easy process. As internal medicine physicians, our comprehensive knowledge and expertise in adult health and our understanding of lifestyle and environmental influences and how everything works in unison uniquely qualify us to provide comprehensive patient care, often for the duration of a patient's life and regardless of whether we're in general internal medicine or we choose to subspecialize and focus on one area. I'm here to show you the diversity of our field. Diversity throughout your day and your week will allow you to avoid burnout and remain excited about walking through those hospital doors and your clinic daily. To find out more about being an internal medicine physician, visit www.acponline.org/I am physician, because I am a physician.